Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Abia and Cross River State fine-tune schools' resumption guidelines to suit students reopening amidst the coronavirus pandemic. Government also provides precautionary materials. Edo State government provides care for the elderly to pursue policies that will safeguard senior citizens against COVID-19. And World Health Organization assures of readiness of vaccines for COVID-19 before year end. "183 people have been discharged across the country in the last 24 hours in 9 states and the Federal Capital Territory, with most of the cases there in Oyo State that saw indeed 67 people discharged. River State discharged 44 persons. 14 were discharged in the FCT, another 14 in Katsina, 12 in Imo, 10 in Bauchi and 9 in Kaduna, 7 in Ekiti, 5 in Kano, and Sokoto discharged 1 person. This brings the total number of persons discharged in the country to 50,951. The Ncdc reported 120 new confirmed cases from 13 states, including the FCT. River State led the top cases with 65, followed by the FCT. Lagos State posted no case, and this is for the first time in weeks. According to the Lagos State Commissioner of Health, Professor Akin Abayomi, total number of COVID-19 tests conducted so far in the state stands at 100,923. And over 2,000 of the confirmed cases have been discharged from COVID-19 care centers following full recovery. They also said that over 15,000 of the confirmed cases were monitored in communities by the COVID-19 Lagos response team and have fully recovered. It continued by saying 43 of the cases are currently under isolation in public and private COVID-19 care centers, while 687 active cases in communities are being managed under the COVID-19 Lagos Home-Based Care Program and are receiving treatment via the ECO Telemed services. Around the world, infection rates have fluctuated as restrictions unfolded. While some countries are doing well, it's different outcomes for others. More than 35.5 million cases of the virus have been confirmed globally, with more than 1 million deaths. This is coming from the Johns Hopkins University. As schools resume in Abia State amid the pandemic, monitoring of adherence to the COVID-19 protocols to minimize the spread among school children is being carried out in some schools visited in the state. Some schools also subsidize fees from 30% announced by the state government to 15% to enable parents pay up, as some parents were unwilling to bring back the awards for the 3 weeks resumption. Our correspondent reports that some pupils seem to know the basics about the coronavirus.
We have been observing all the COVID-19 protocols, which involves the washing of hands. Like every morning when the students come at the gates, we check nose masks, those that have their face shield and nose masks, because without that, we don't allow them inside the school. We also have a thermometer, which we use to do the temperature check their temperature to find out, to know if they are in good condition. According to the instruction from the government, the directive, we were told not to allow them to go for break. That if they want to, it should just be 5 minutes, they stretch themselves and then do bodily exercise or go back so that they don't spread the virus, because we notice that during breaks, they play around trying to hug themselves and you see some release of heat and stuff like that. So that's why we don't allow them to go out, so that we don't spread it.
Well, we observe it by having social distancing, sanitizing, no playing, stay in your chair, and we sit 1-1. Because when you come in contact with your fellow human beings, you don't know who have the coronavirus. You might get the disease from one another.
Over in Ogun State, the government says it is partnering with the federal government under the social housing scheme to develop 10,000 units of affordable homes across the state to mitigate the challenges and effects of the coronavirus pandemic. The news was revealed by the state governor, Dapo Abiodun, in Abeokuta, the state capital, while speaking on the occasion of the 2020 Habitat Day celebration. The governor said another 2,500 units are being considered across the state to bridge the housing deficit.
The social housing scheme, which is part of President Buhari's economic sustainability plan to mitigate the effects of COVID-19. And that plan is to provide 10,000 social housing units in Ogun State. For us in Ogun State, this theme could not have been more appropriate at this time, that we are stepping up efforts to ensure that we solve the challenges of housing deficiency and housing quality in our dear state. In line with our determination to fulfill our electoral promises to our good people of Ogun State, and to align with the Agenda 2030 of the United Nations, we have commenced affordable mass housing provision at different parts of our dear state. The signposts of our housing scheme being the Prince Court 1 and 2 Kenta, Idiaba, Abeokuta, and the King's Court at Okemos, Abeokuta. We are not limiting these housing schemes to just the state capital alone. I've also approved these housing schemes for implementation, and implementation has indeed started in Shagamu, Iperu, Ijebu-Ode, Shagamu, Obafemi Owode, Ogijo, Lagos-Ibadan Expressway, Kobakwe, and Ota. We plan to build 2,500 affordable housing units by year 2023.
And News Just In says that following the report of the Independent Corrupt Practices and Other Related Offences Commission, ICPC, that the sum of 2.67 billion naira released to the 104 Unity colleges during the COVID-19 lockdown for meal subsidies found its way into individual accounts, the Education Minister, Mr. Adamu Adamu, has ordered a full-scale investigation into the matter. In response to the queries issued by the Federal Ministry of Education, the principals explained that payment on meal subsidies to Unity colleges on the Government Integrated Financial Management Information System platform is designed to accommodate individual officers of those colleges who are officially recognized to receive such payments and disburse same to food vendors. Now, the following difficulties encountered by farmers. The investigation is to establish the veracity of the claims to ensure that there is no diversion of public funds or misappropriation of the same. Now, the World Health Organization is warning countries in Europe about what it calls pandemic fatigue, which it says threatens the continent's ability to tackle the coronavirus. The EU is facing what many have called a second wave, but although fatigue is measured in different ways and levels varying per country in Nigeria, it is estimated compliance levels are dropping. We have joining us from Abuja studios Dr. Laz Udeze, a public health physician, health policy advocate and development consultant. Thank you for joining us on the program.
Thank you, Millicent, for having me.
Now, over the last 8 months, citizens around the world made sacrifices listening to their governments and task forces on COVID-19, their efforts at containing the virus. But looking at our numbers now, is it impossible to feel perhaps demotivated and to experience fatigue?
Well, nothing is impossible looking at the numbers, but I think over the past few weeks, we might have noticed that the curve is flattening. And, that could be explained by different reasons, not just one factor. Yes, it could be because we are testing less. It could be because there's some level of herd immunity and less number of persons are, having symptoms. It could also be that people no longer feel threatened by the COVID-19. It could be a combination of so many factors, but, nothing is really impossible.
So other than, the Presidential Task Force briefing, twice a week or the Ncdc updates, what new and innovative ways can we use to reinvigorate the fight against COVID-19? Because if we look at what a number of countries are doing now, especially countries witnessing a second wave, you find local authorities in the UK are consulting communities to sort of gauge their feelings. We understand that students in Denmark are involved in drawing up restrictions that would allow them to return safely to schools. Turkey is also doing social media polls to understand the public sentiment. And Germany has gone as far as consulting philosophers, theologians, behavioral social scientists, sort of to get them involved and perhaps to stop the fatigue.
Yes, in Nigeria, I think the actions need to be more localized. You may remember that when the pandemic started, most of the actions were led by Ncdc. After a while, then the state ministries of health and the state task force took charge. But we can't really say that so much is being done at every level. It also speaks to the stage of our healthcare system, because we can't build something out of nothing. At the beginning of the pandemic, I usually say that we cannot perform beyond the capacity of our healthcare system. So over the past few months, there have been some pockets of progress here and there, especially in the number of laboratories that have the capacity to diagnose COVID-19, as well as other health conditions that might require PCR diagnosis. But I think what we need to do now is to begin not just to be looking at COVID-19, but our entire healthcare system holistically. Because yes, COVID is here, it's just an addition to a number of healthcare challenges we have. We still have 37 out of 100 children under 5 years being stunted. They are too short for their age. We still have malaria. Nigeria is still the #1 country with the highest burden of malaria. We're still number 5 in tuberculosis. We are still number 4 in HIV/AIDS. When it comes to malnutrition, we are number 2 in the world. So a whole gamut of our challenges in the health sector. Let's strengthen the system to tackle all of them, leveraging on the COVID-19 pandemic and beginning from primary health care. Primary health care go beyond buildings. It's an entire system that we must strengthen from the local level and build bottom up.
We'd like to thank you so much for joining us on the program. Dr. Laz Udeze is a public health physician and health policy advocate, development consultant. Thank you for joining us. Now, the increase in the number of personnel trained in special care for the elderly as well as elderly-friendly hospital are some measures deemed necessary for the improvement in older persons' care. A medical expert in Benin City believes that the COVID-19 pandemic came with experiences and lessons in the care of older persons. Here's more, our correspondent, Jessica Olubushere.
The World Health Organization in a recent publication notes that there are currently more than 1 billion people aged 60 years or older, with most living in low and middle-income countries. Experts also note that older persons with their experience and knowledge contribute significantly in their communities in various areas. In Edo State, southern Nigeria, a medical expert in the field of geriatrics with the University of Benin Teaching Hospital, UBTH, notes that while stereotyping of this group of the population as needy and frail persons is not helpful in providing care for them, improvement in older people care is necessary.
In 2020, from January to August, 55.6% of patients who were admitted into the intensive care unit of this hospital were age 60 and above, excluding COVID cases. That's a huge number. So to run hospital business or to run the healthcare business without factoring in the specific peculiar healthcare needs of older persons is one thing we need to change.
The emergence of the COVID-19 pandemic also raised some issues. Cases of anxiety, depression, and abandonment were also said to have been recorded, while many failed to access health care as a result of fear.
If I go there, I will catch the disease because they are treating COVID patients in XYZ place. Yet another level of fear was, if I go there, I will not be attended to because the healthcare workers themselves are afraid of catching COVID or getting COVID from us, the elderly people. So there were a lot of issues that impacted on access to care for older persons as a result of the COVID pandemic.
For the Edo State government, the pandemic has brought lessons, and it says efforts are on to do more for the elderly.
We have an insurance commission in the state, and the scheme has developed different models. And part of the model is centered on these elderlies. And of course, once that scheme goes into full implementation, the elderlies in Edo State will benefit a lot from it.
The call is also for hospitals to adopt elder-friendly hospital initiatives with assistive fixtures like grab bars, which some older persons would need, and an increase in the number of personnel trained in special health care needs of the elderly. Jessica Olubuse, Channels Television News.
We have more on the COVID-19 updates when we return. Please stay with us. In Cross River State, public schools are under lock and key as students await the official announcement by government for schools to resume. Plans are, however, in top gear by government towards adherence of the COVID-19 protocols by doubling up on efforts in producing the face masks, face shields to be distributed to both students and teachers for free.
With the outbreak of the corona pandemic that has almost come to stay, we are worried that our children have long overstayed at home. The children will wear the face masks plus the shield as we enter into the class. From the gate, they will wash the children's feet, the hands. Hand sanitizers will be used. When the children enter into the class, they will remove the face mask but use the face shield, apparently to get enough ventilation. Upon closure, they will still wear back the face mask and wear the shield as they go back home. The teachers also will wear same and undergo the same corona protocols. We will also be continuously producing face masks as well. We will come up with resumption notice. We will come up with resumption protocols, things the schools and the children and parents must do before they come to school, they must do while they are in school, and they must do as they leave school.
Professor Olumuyiwa Odusonya is a professor of public health with the Lagos State University Teaching Hospital, LASUS. He joins us via Skype from Lagos. Thank you for joining us. I'd like to begin by talking about Lagos. I mean, yesterday it didn't record any case, and we've been seeing a decline in cases in Lagos. How much of a perhaps success story would you say that Lagos has had in its response to the coronavirus pandemic?
Thank you very much. Lagos has been the epicenter and also the state with the most success story due to the devoted activities and energy by the incident governor, incident commander, Mr. Governor himself, and the Commissioner for Health. Built upon years of building capacity for dealing with epidemics like the Ebola one and investing in the health structure. Yes, there are a few things at the beginning, but Lagos has ramped up testing, and the numbers in Lagos, the curve is beginning to go down, and Lagos has a success story itself in combating the coronavirus pandemic.
Professor, a lot of people are asking questions. I mean, with schools reopening, do we really have a good grasp of the risk assessment of the situation? I mean, in terms of the level of community transmission?
Well, we do. Science is data-driven, evidence-based. And if you were to look at the epidemic curve, it's beginning to reduce. The number of tests we're doing is declining, but positivity rate is about less than 6%. From what was done even yesterday, 120 results out of about 2,120 that's sign of progress. In many places, we are below 5% or thereabouts, we are good. So we are on top of it as a country. Yes, there are test results that are not as extensive, but there is sufficient evidence to say that the community transmission is not increasing because about 7 out of 10 infections have no known history or known exposure. So it's community-based transmission, but we're conquering it very well and dealing with it well.
So testing is perhaps on the one hand. How about contact tracing and, isolation, also being able to detect, COVID-19 cases? And this is as, schools are reopening everywhere across the country. Will they be able to tell or suspect cases and handle it?
Well, the government has given out very broad guidelines. First, on prevention, even to schools. That's why they were shut down. And schools, that is just one bit of the exposure mechanism. These children will be at home. Their parents go to work. So we're already opening the economy, and it means that you can contact it anywhere. So opening schools at this point does not increase the risk. Rather, what we need to do is to make sure that the sources of prevention are adhered to, wearing a face mask, washing of hands, and then if there are other cases, they're rapidly tested to know what to do. So opening the schools at this point is a very rational decision to make by the health authorities.
We'd like to thank you, Professor Olumuyiwa Odusonya, Professor of Public Health at LASUTH. Thank you for joining us on the program.
Very much for having me.
The World Health Organization says there is hope an effective vaccine against COVID-19 could be ready by the end of the year. The message of hope is coming from Director General of the global body, Dr. Tedros Ghebreyesus. Here's more on the global update.
The message from the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, was not much as it pertained to how soon vaccines could be ready. Addressing the end of a two-day meeting of its executive board on the pandemic, he said,
"We will need vaccines, and there is hope that by the end of this year, we may have a vaccine. There is hope."
9 experimental vaccines are in the pipeline for the WHO COVAX Global Vaccine Facility that aims to distribute 2 billion doses by the end of 2021. Meanwhile, organizers of an annual religious festival in the Senegalese city of Touba are expecting 3 to 5 million pilgrims this week, despite the main ceremony today being cancelled in an effort to lower the risk of coronavirus contagion. Other events are being video streamed to avoid overcrowding, but no restrictions were in place to prevent followers of the Morid Brotherhood from making the trip to the sacred site. Spain has become the first Western European nation to surpass 800,000 total coronavirus cases. The cumulative tally on Monday hit 813,412 after Health Ministry data registered 23,480 new infections over the weekend. And with 850 COVID-19 infections per 100,000 people, the Madrid area has Europe's highest rate. So, 4.8 million people in the city and 9 satellite towns have come under new restrictions from Friday. Italy has reactivated an action committee in fighting COVID-19 under the country's Civil Protection Department as fresh daily data confirm the contagion's upward trends again at the national level. The country recorded 2,257 new cases on Monday, bringing the total to 327,586, according to data released by the Ministry of Health. It is the 5th consecutive day of at least 2,000 infections.
Remember that wearing a face mask incorrectly is as good as not wearing a mask at all. Continue to take responsibility. Visit our website. It's channelstv.com. You get more updates on the pandemic, several other stories as well at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.